So, session 13, section 4, and here we're going to look at referrals. So you remember I talked to you 2 sections ago in section 2 about networking. So networking and referrals really go hand in hand together, and so we'll come back here and look at referrals. Now, depending on your modality, there may be some indications that might alert you to the fact that you need to refer on. Let's have a look at a list of indications for referrals for, say, somebody who's doing therapeutic massage. Now, if that's your modality, then these might be some of the reasons why you would refer on to somebody who could work with these things. Pain: local, sharp, dull, achy, deep or surface. Fatigue, inflammation, lumps and tissue changes, rashes and changes in the skin, edema, mood alteration, such as depression or anxiety, infection, local or general, changes in habits, for example, appetite, elimination and sleep, bleeding and bruising, nausea, vomiting and diarrhea, temperature, hot, fever, or cold. So this list is very important for somebody who's doing therapeutic massage, because the scope of their practice does not take into account these type of conditions, and it's not in their scope of practice to treat those type of conditions. Whatever modality that you are working with, you will have your own list, because in some cases it may be that these might be things that you might be treating yourself. But it may be that some deeper psychological disorder, some indications of something more sinister, they might be something that you might refer on to. Or, for example, it may be a dislocation, a structural dislocation, bony dislocation, which you know that you can't manage. As a naturopath, for example, you might refer them on to a chiropractor or to an osteopath. So you will have your own range of indications for referrals depending on the modality that you're working in. So let's have a look at referrals. It's important when you choose to refer to another practitioner that they are well trained, qualified and experienced within the modality of the referral. If you refer to somebody who's not trained or who's not experienced, in a lot of ways that will reflect back on you. So always make sure that those people to whom you refer are people you go to yourself. How do you find a suitable practitioner then to refer to? Well, recommend practitioners that you'd see yourself professionally, that have given you good results. You can't come back any closer to the fact that if I'm satisfied with this practitioner, they will be. Ask the advice of other health practitioners, of other health professionals. So ask around, check up with your peers, check out with your professional peers. Utilise a professional association recommendation as a source of referral. Always a good idea. You can't go wrong with that. Most associations keep records of specialties. Be sure to be clear about what your client's needs are, and use business or yellow directory, or do an internet search to establish if the modality has a representing association, if you know little about a modality or area of medicine research. So ask for their recommendation, the relevant association that you connect onto through the business or yellow directory. So, as we said at the very beginning, make sure that the person that you refer to is of high quality and well qualified. Some of the referral sources that you might think about might be word of mouth recommendation from somebody you trust, especially a patient of the practitioner may work, but word of mouth, if referring to practitioners you know well, the criteria is that they have greater expertise than you in the area relating to the referral. So very important. Again, I come back to don't refer on to somebody who has less qualifications or less scope of practice than you do. This could be true of patient recommendation too. So think about websites again and think about yellow pages. Referral policy and procedure. Here's an example. So in your policies and procedures, in relation to referral, this might be something that you might be thinking about. So when the practitioner feels unable, due to training, skills or outside scope of practice, to treat the client's condition, or if the client requests, a referral may be made to a suitably qualified practitioner, be they a complementary or an allopathic practitioner. I've referred many times in my practice to both doctors and to, generally I select a doctor, when I refer, I select a doctor whom I know has a holistic type of approach. But in many cases I've referred to other complementary practitioners. The procedure that you would use. The client's needs will be discussed. The practitioner will gain the client's informed consent to refer. So these are the things you would have. This is the way that it happens. A referral will be made from the database of appropriate practitioners. Gain client consent in writing to release necessary client information. Prepare an introductory letter which should briefly introduce yourself and give details of your treatment and the reason for the referral. Make a file copy and attach that and the client release form to their file. Post the letter to the practitioner or seal it and give it to the client to take to the new practitioner, and ensure that the client knows how to get to the practitioner's premises and indeed that they have made the appointment, the appropriate appointment, etc. So this could be literally written policy and procedure that goes in your policies and procedures handbook. For mental and emotional presentations, now we looked at the beginning of the last set of slides in section 3, the notion that emotional states and severe emotional states, prolonged emotional states, are very often a causative factor in a physical disease in the body. So, and it's not unlikely. Human beings are fragile, human beings are vulnerable, and relationships can be very difficult pathways to negotiate. So be prepared that there will be a number of your clients who will have emotional or mental disorders or disturbances. So in that instance, if you feel it to be out of the scope of your practice, then it's appropriate that you refer for mental or emotional presentations to a counsellor, a psychotherapist, or a psychologist is appropriate. Okay, very appropriate. So you need to have a good file of those people, or a good number of those people on file, I should say. Psychologists and most counsellors are now expected to register with their board, the Board for Psychology, and Peak Association for Counsellors. When you're networking, make sure that you have a list of fully qualified, as I said, and trusted psychologists and or counsellors to refer clients who require assessment or treatment for mental health issues. You will come in contact with these people. They will come before you, believe me. As a part of your networking, it's also useful to have government mental health information in local district, city hospitals and community health departments. So in my experience, I've had people who with quite frank symptoms of schizophrenia appear before me in my clinical room, and I need to have the skills to be able to manage it. And in cases like that, I don't. And so you always need to have appropriate mental and emotional backup and support through your local hospital. Okay, here's an activity that you're going to come up with. So choose members of your group and discuss the following. What presenting signs might lead you to believe that a client requires either counselling or mental health assessment? Think about it. Just think about some of the behavioural discrepancies that you might experience with a client. What are some of the key words you might hear from your client that would lead you to conclude this? Maybe what might their appearance be? So these are usually clues to the fact that people are disordered in their mind or their emotions, and therefore usually present disordered in their speech patterns, in their behavioural patterns, and in their presentation, the way they present. Let's have a look at a few definitions of psychology, psychiatry, and psychotherapy. Psych or psycho is a combining term denoting the relationship to the psyche or to the mind. Psyche in Greek means mind. So psychology is the study of the mind, that branch of science that deals with the mind and mental processes, especially in relation to human and animal behaviour. Psychiatry, psyche and iatria is healing, so that branch of medicine which deals with the study, treatment and prevention of mental illness. And psychotherapy, psycho and therapia, I'll get that right, treatment, is treatment designed to produce a response by mental rather than physical effects, including the use of suggestion, persuasion, re-education, reassurance and support, as well as the techniques of hypnosis, abreaction and psychoanalysis. So good clear definitions there to do with the mind and to do with mentation. What is a psychologist? Well, psychologists study the way people think, act, feel, think, act and interact. Through a range of strategies and therapies, they aim to reduce distress and to enhance and promote emotional well-being. So they will have studied human behaviour. They actually understand how the mind works, how the memory works, how learning is achieved, and they will understand human development. They will know then when there's something that's out of whack or out of kilter, out of balance. Psychologists can assist people who are having difficulty controlling their emotions, thinking and behaviour, including those with mental health problems. Have a look at that website down there. What is a registered psychologist? All practicing psychologists are legally required to register with the Psychologist Registration Board in their state or territory, in the same way that medical practitioners must be registered. This means that they must be competent and follow a strict code of conduct. Now, important to understand that not all counsellors or therapists are registered psychologists, so there's a difference, a difference between the two. The Australian Psychological Society, APS, has a referral service to help locate a psychologist in a particular geographic area and area of expertise. For further information, refer to that website there, and there's the Australian Psychological Society with its phone number, a Victorian phone number, listed there for you. Now, look at one of your 3 case studies that's in your handouts. What issue would this raise for you in terms of professional development? How might the practitioners benefit from having a strong network? Okay, so one or all of the 3 case studies. I'll see you at the next slide. Okay, what is a psychiatrist? A psychiatrist must first train for a bachelor degree or higher in medicine. So psychiatrists are very often strongly trained in the orthodox medical model. They are then required to have 1 year's hospital-based training, so as an intern, they go into the hospital, and then they can branch out into psychology, required to complete at least 5 years of specialised study and training. Registration or licensing is required, and psychiatrists must choose specialties, so child psychology or adolescent psychology, I'll say that again, child psychiatry or adolescent psychiatry, and so on and so forth. Psychiatrists, I might just add at this point in time that psychiatrists have commonly tended to work with drug therapy, to work with their clients, and based on the understanding or the notion that they're working, by working through the medical model, they haven't been trained necessarily in a holistic framework. Many psychiatrists now are breaking free of that model and are starting to work with different psychological systems and psychological understandings, and a lot of different types of psychotherapeutic strategies. Counsellors. Counsellors and psychotherapists in Australia must be trained according to national standards and must register with a peak association in order to practice. And these are the associations as follows: the Psychotherapy and Counselling Federation of Australia, known as Part4, and the Australian Counselling Association, known as ASAR or ACA. So how do we choose a counsellor? Membership of a recognised professional association such as ACAR or the Psychotherapy and Counselling Federation, Part4, should be well regarded. So you know that if somebody is a membership in one of those associations, then they're accredited, they're licensed, and they've passed the required educational standards, achieved the required educational standards to be admitted to the associations. Check that the counsellor's qualifications from a registered training organisation and is approved by state or federal governments. There are quite a number of counselling courses out there, but it must be an RTO, registered training organisation, and approved by state or federal governments. Experience with Lifeline Australia, which offers extensive training and valuable experience in counselling in all states and territories, should also be well regarded. And experiencing in counselling for non-for-profit organisations, NFOs, either as a volunteer or as a paid employee, indicates useful further training and experience. So there are a number of different ways that you can actually access or into the network, or you can get into the network of counsellors. What about mentoring? What is a mentor? A mentor is often identified as a person with greater experience, expertise, and usually a senior to the mentoree who is willing to pass on the benefits of experience and expertise. So mentoring comes from somebody who has the wisdom and the experience and the skills to pass on to somebody who's less experienced and may even be in training. A mentor is said to teach the mentoree about particular issues. A mentor will facilitate and assist the mentoree in the gaining or gathering of their skills. It engenders the mentors, and they will enthuse the mentoree's learning and knowledge by sharing resources and networks. They challenge the mentoree to move beyond his or her comfort zone. They create a safe learning environment for taking risks, and they aim to facilitate the mentoree's development. So there's a website there to have a look at, and you may choose to work with a mentor. You may choose to cast around and find somebody who might be willing to take you on in a mentoreeship. Think about it. It's certainly worthwhile if you have misgivings or caution. You're feeling cautious or even a bit nervous about going out into practice. Then seek out a mentor. There are many people who will be willing, I'm sure, within your chosen profession to actually work and assist you to gain that confidence and to gain that enthusiasm. And remember that whatever happens, it's where your heart is. When your heart's engaged, excited, passionate about the work that you're doing, you will find the right person to mentor you. You will find the right premises, the right and appropriate clients will come to you during your, if you like, your area, your time of building your skills. Remember always that when your heart's in the right place, the right people will come. So all the best in your setting up and building up, setting up a practice and beginning a practice. And remember, lead with your heart. Have a look at an activity 13.6. Supervision and debriefing were explained in earlier presentations. Revisit the notes concerning debriefing and supervision in establishing a practice session and case-taking session. Then answer these questions. Could a mentor also be your supervisor? Ask yes or no. Explain your answer for either yes or a no answer. Would a mentor be an appropriate person to provide you with a debriefing? And how would you differentiate between a debriefing, supervision, and a mentoring program? Okay. If you'd like to have some feedback on this, if you'd like to expand on those thoughts, if you'd like to get other people's ideas and other students' ideas, post any questions you have and thoughts to the online forum for discussion and feedback from your peers. And remember, as I said before, stay leading with your heart. Here are some revision questions which will help to encapsulate and bring together session 13 for you. Define in your own words what integrative medicine means. List any 3 resources for new and emerging trends in your modality, either trends in treatment or in business. What are the 3 basic realms for healing within the integrative medicine model? Reflect on the differences between a psychologist and a psychiatrist. I might have given you a little bit of a clue in that. Which of these therapists are registered? A psychologist, a psychotherapist, a psychiatrist, or a counsellor? List 3 reasons for a referral to a third party. List 5 examples of networking. What is the cornerstone of the integrated medicine model, and in which ways can skills and knowledge be improved and upgraded on a continuing basis? Go well, enjoy, and most of all, find joy and pleasure in your practice, because it's very rewarding, very satisfying from the point of view of somebody who's been in practice for 35 years, and it never ceases to give me joy and pleasure. So go well, and thank you.